Well, it's getting worse. South Africa's COVID-19 positive rate now stands at 21%, double what the health ministry considers ideal. Amid the second wave of infections, are current regulations enough to stem the alarming surge? Let's find out. Professor Adrian Puren from the National Institute of Communicable Diseases joins us now live from Pretoria. Thanks for your time, Prof. We appreciate it. So this 10,000 infections over a 24-hour period is worrying. What do you reckon?
Yes, it is of concern, and I'm sure the numbers today may well continue that trajectory. I know that there's variability in testing, but when you look at what we call the heat maps in the different provinces, in particular the Eastern Cape and the Western Cape, you can certainly see that those green, light orange have now changed all to red along the coast of the Western Cape, as well as the Eastern Cape as well. And certainly we are certainly starting to see changes in KwaZulu-Natal. Gauteng, not to the same extent, but I suspect if the trajectories that we are seeing in the other provinces are anything to go by, we may well see those trajectories repeated in Gauteng and the other provinces to follow as well.
Outside of the lack of social distancing, not wearing masks, etc., is there any other scientific evidence to show that the virus is spreading at a faster rate because of anything else?
No, I think that the one concern, and again I want to allay concerns, is that people are looking at the virus to see whether or not there's any change. I think you are referring to the recent reports from the UK, for example. So people are constantly looking at the virus, and until there's definitive proof, there's no real evidence that that particular virus is changing. I think it all comes down to the fact that the events in terms of the physical distancing, the wearing of masks, the hand hygiene, these are still all the key factors that I think are really contributory. If there is a lack of these particular activities, then that's when the virus will certainly continue to be transmitted.
And Prof, let's talk about people who have been infected. We know that it's hundreds of thousands in South Africa who have recovered as well in particular. What do those people actually keep in mind now? Because many people say, well, I've been infected, I don't really have to worry that much. But what's the reality to this?
Yeah, so my sense is that we still have to worry. There is evidence, not always recorded, published literature, but there is evidence that people who have been infected are becoming reinfected. Whether they're the majority of people or not is not really clear, or whether they're just a small minority. But regardless of that, all those particular requirements, such as wearing the mask, the hand hygiene, the physical distancing, still applies to you as an individual that has been previously infected. Because the whole point is, and you mentioned that in your introduction, is that people still are ending up in hospital. And we've read about the reports in the Eastern Cape where hospital facilities are under strain and people are dying. So again, our rates of death, for example, are approximating, I think, about 60% of the deaths that we saw in the first surge or first wave. So it is still a very serious matter that even though the majority of us will recover and have the mild course of the disease, the consequences of actually transmitting this virus to others, especially those individuals who are vulnerable in the older age groups and have comorbidities such as respiratory disease, cardiac disease, hypertension, diabetes, and obesity, those are the people that are vulnerable, who are sometimes not even reaching our hospitals and dying at home. So those are the key things that we need to bear in mind when we say we're not going to be wearing masks, we're going to attend events with large numbers of people. And therefore, those are the things that we really need to take into consideration.
Yeah, and I'm going to harp on this thing about the people who have already been infected because there were 774,585 recoveries, which means that very many people were infected in South Africa. So when you are reinfected, as we've seen in other parts of the world, does your body automatically fight the virus off faster than previously? Do you have a better chance of surviving?
So again, we don't have much information around that. So in fact, the two reported cases, for example, had different clinical presentations. The one had a more severe course of disease, and the other was really a chance event of identifying someone who was really asymptomatic, but was picked up and was tested randomly. So, it can certainly vary, and we do know that genetic backgrounds, I'm not sure that the changes in the virus are that critical, but there are certain background changes which may well affect the severity of the outcome.
And just lastly, in terms of the measures put in place now to try to curb the spread of the virus, would you agree with them given the increase in numbers that we're seeing?
Yeah, so each province needs to develop a strategy, and they have done that in terms of the resurgence plan. We have data, and the community is welcome to there's a website that we've provided to your station that can be made available. So all the communities who have access to this particular website can look and see what is the level of infection in their district or sub-district to get a sense of what the risks are. And each province needs to look in a very nuanced way what are the requirements in order to manage the resurgence that would occur and take the necessary or appropriate action. That's engagement with the community, risk communication. If it means particular actions that are different from other provinces, then that is how they need to proceed to actually manage the transmissions in our communities.
All right, thank you so much for your time and your insight. Appreciate it. Professor Adrian Puren from the National Institute for Communicable Diseases.